Here is MRI of the lumbosacral spine in a 60-year-old with history of low back pain. So I have already magnified the images. We have got sagittal T1, T2, and STIR and axial T2 sequences of the lumbar spine. The abnormality is at L3-4. What we are seeing on T1 weighted sequence is ill-defined low signal intensity with loss of definition of the end plates at few parts. On T2 and STIR, there is heterogeneous increased signal intensity. Added to that, on the sagittal STIR sequence, there is increased signal intensity of the disc. If you compare the rest of the discs, this disc has got definite increased signal intensity. Also, there is abnormal prevertebral soft tissue signal along with small area of possible fluid signal intensity. On the axial, what we see is loss of definition of the medial aspect of the right psoas muscle with ill-defined abnormal signal on that side. So, based on these appearances, findings are highly suspicious for discitis, but clinically there is no mention that the patient might be having discitis, which is quite common in this age group, especially if the patient is diabetic or on steroids. So, how do you summarize or conclude the report? So, in the conclusion, we need to write there is a very high suspicion of discitis, and the report needs to be urgently communicated with the referring clinician, and correlation with inflammatory markers and urgent treatment needs to be started.